Hello and welcome everyone. Today we are going to dive into a very important topic, that is children's mental health, which no one has touched anytime. Today we have Dr. Meghna Ramaraju here from Little Wonders Clinic, Kokapet, Hyderabad. She is having 5 years of expertise in pediatric field.
Hello.
Hello.
Thank you for having me in this rare and beautiful session.
Let's talk with the basics today, ma'am. So, generally, we talk about adult mental health, but we tend to forget about children's mental health, the stress they face, the anxiety they go through. So, I would want to know from your side as a pediatrician, what challenges does kids face as they go through?
So most commonly in today's world, they are facing issues like anxiety, ADHD, and even childhood depression. Unfortunately, is on the rise in kids. So it doesn't look on the outside that the child would have these kind of issues, but they're quite prevalent, and the awareness in the society regarding this issue is actually quite less. So that is why at an early stage, parents are unable to recognize it. So these are the most common things that kids are going through. And also kids with other disabilities and other physical disabilities, they are also going through constant bullying or anxiety issues, which are contributing to a major part of the mental health in children.
True, ma'am. I think the rising cases now more is in terms like school complaints or bullying. Seen a lot of, especially at the age of like 7 to 10, we are
Correct.
seeing it more.
And one more thing that we have seen is learning disabilities. So I think they were there previously also, but we didn't have the tools to test, and we didn't have the enough awareness in the society about that. But now, because of social media, because of people like you who are spreading the information on social media, and also because of movies and all done by famous stars, we are also seeing that there are a lot of learning disabilities, and many are coming to light, and early evaluation, and kids are coming out without much problems.
True, ma'am, that is true. And I think it is very important for parents to take a step where, see, awareness is there. It's just that they have to take a step.
That's
So, ma'am, I would want to know, like, there will be parents who would be a little hesitant to realize that the child has an issue. So, how would you suggest?
So actually, not many. Most of the parents are hesitant to talk about their kids because obviously, as parents, we want to glorify the kids. We want to see what good they are doing. So usually, they are a little hesitant to talk about these issues. But as pediatricians, I think we are on the first foot of this to make them identify, because when they come for evaluation for some other issue or some vaccination or something, we have to catch those subtle points where they are having, either they're just being stubborn as kids, or they're having a behavioral issue, or they're just crying as a normal kid, or they're crying out of anxiety or depression. And what is their sleep pattern, what are their mood patterns, how is it going, how is the academic things going. These we have to ask the parents as subtle points without hurting them much, or without feeling that we are intruding into their personal family space. We have to do that. And after us, the second point comes in the referral. Like whenever we see that there is a behavioral issue, the first thing I think as pediatricians we need to do is to refer to a good child psychologist so that they can further evaluate. Sometimes in the initial assessment, we might feel that there is nothing, but it might come out as something, or the other way around, wherein the child is looks like having a behavioral issue, but it might just be a small issue which can be solved by a simple counseling session. So whatever it is, first step is identification, either by the parent, or if they have failed to do so by the pediatrician. And second is a good referral, and that referral should take care of the rest of the things for them.
So it is very important for parents to get referred to a psychologist or whichever field you like the child is going through. Maybe a pediatrician or a doctor or a professional could help them. So I would want to know like what parents can do to support child's mental health now.
Fortunately or unfortunately, we are living in a world where mostly both the parents are working. That is first. And second thing is, previously we used to live in joint families where grandparents, uncles, aunties, someone used to be at home for the child to feel secure every day. But now that is not the case. So these nuclear families and both working parents have caused this. And one more big devil in the world is, I feel, it's screen time. So as soon as the parents come also, they're glued to their laptops or phones or social media or work, whatever it is. So it's like work at office and work from home also. So one thing I would like to tell is, first, we have to encourage good interaction with the kids. That itself will solve so many problems like virtual autism and all. And a second thing is, limit screen time in kids. Just because you are busy, you should not allow for screen time, or because you are tired coming from office, you shouldn't give a phone or an iPad to a child and say watch it. So limit screen time in kids, and obviously in yourself also. They will obviously learn only by modeling behavior. If you don't hold your phone and you tell your kid also not to hold the phone, that is the time when the kid is also going to leave the phone. And secondly, encourage outdoor play. So when you go outdoor and you play, the kids get tired. They're stimulated by natural stimulating factors like environment, greenery and all. And they will make friends, learn new interactions, not at the level of the screen, but at the level of the social realm. They are going to learn a lot of things. So these, just avoiding screen time and avoiding sedentary life, and also reducing the sugar intake in kids, which can reduce hyperactivity in them and can lead to so many other good reforms in the child. So the behavior of the child will be so much better if you reduce the sugar intake. So give the screen and give a chips packet and let them eat and watch the screen. This is what is going on in most of the households. So that should be limited, and parents, at the end of the day, whether you're tired, whether you're off work, it's very hectic, you have to spend more time with the kids and you have to spend less time with your phones.
True, true. Wow, ma'am, it's a wonderful tip which you have given to our parents. I hope this message spreads to everyone. Thank you so much, ma'am, for being here and giving very good advice and tips to our parents. I hope this message reaches to everyone around, and thank you.
Thank you for having me.